everyone. Today we will be interviewing Dr. Sands, who works as one of the lead colorectal surgeons at Cleveland Clinic. She is also the head of the Cleveland Summer Scholars Program, which gives high school students and college students the ability to look backstage into the world of medicine at Cleveland Clinic. Dr. Sands, can you tell us a bit about yourself and your work?
Well, first of all, thank you so much for the opportunity to be here to speak with you. I am a colorectal surgeon. I have been working at the Cleveland Clinic for 24 years, but also I am a mom of two kids, and I have two boys, 18 and 20 years old. And I am a wife of just last week, 27 years. So I've been at the clinic working this time, and I get very, very excited about inspiring young people to go into medicine and to pursue challenging careers that are hard. And, you know, just showing them a path that you can really have everything.
What inspired you to pursue a career in colorectal surgery? And what challenges did you face as a woman in this industry?
So that's a great question. I always tell people nobody really wakes up and says, as a teenager and says, I want to be a colorectal surgeon because that's the coolest thing I can think of. I actually went to medical school thinking I would be a plastic surgeon because I was really interested in art and sculpting and painting. And I like to make beautiful things and work with my hands. So I thought I would be a plastic surgeon. And I knew when I went to medical school that I was going to do something in the surgical realm. Again, thinking plastic surgery. And my sister actually contracted ulcerative colitis when she was 19 years old. So shortly before I went to medical school, she became very ill, and there were very few people in the country that were doing the full gamut of reconstruction for ulcerative colitis in the late 80s, early 90s. And she came to the Cleveland Clinic because that was one of two choices that she had to go to, so that she didn't wind up as she was a model in New York City. And nobody wanted to operate on her because they said she was too pretty, and they didn't want to give her an ostomy bag. They thought that would be terrible. And she sat in the hospital now. For what I realized, at this stage of my life, is an inordinate amount of time on very high dose medicines trying to avoid surgery because everybody thought it would be terrible to operate on her because she was young and she was pretty. And when she got her surgery, she almost died and ultimately was able to be reconstructed. And that's what really fueled my interest in colon and rectal surgery. So when I went with her for one of her yearly checkups, one of the early ones, I met some of the surgeons there, and they became my mentors. I asked if I could do research there during the summer, like a summer scholar. And I went to the clinic and I did research, and the people that were there working in colorectal surgery became my mentors. And that's when I realized how important mentorship is. And I came back, and then I came back again and again, and then ultimately realized that I didn't want to be a plastic surgeon. I wanted to be a colon and rectal surgeon and do my artistry on the intestines rather than on people's faces. And that's what happened. But as a woman, when I first, when I was training in general surgery, I trained in general surgery from 1996 to 2001. And there were very few women in general surgery at that time. They certainly weren't taking time off. They certainly weren't having kids during training. It was always just automatically assumed that you would, if you were going to have kids, you would have them after your training. Nowadays, it's very, very different. There are many women in surgical training programs. There's many women in surgery. They take time off. They show up to fellowship in colon and rectal surgery with me after finishing their general surgery, sometimes with 2 and 3 kids. So it's a very different environment for women. I think I probably worked twice as hard as my male counterparts, and I you know, that was important to me because I wanted people to take me seriously, and I never wanted anybody to say, "Oh, she got here because she's a woman," or because my husband wound up working at the university, and I always worked twice as hard as everybody so that I could prove what I was doing there was valid.
Your journey is so inspirational, and I think it also shows us how, like, moments in our life can completely change the trajectory of what we want to do, and I think that that's something really important that people should realize, like, it's not a linear path, but, like, things will happen in life that will change that path. I also think what you said about as women having to work twice as hard to achieve that same level of respect. I think that's something that a lot of the mentors that we've talked to, they've brought up that point, and we've also seen it working as like leaders in our own clubs, like on a smaller level, but it's still there. So I think that that point is really important to teach young girls today. We wanted to ask you, how would you spoke about some of your mentors. So we wanted to ask you, how would you recommend young girls to gain their own mentors in the different fields that they want to go into?
Just put yourself out there. I mean, somebody who, you know, programs like our Summer Scholar program, um, the people that do this kind of work with young people obviously are passionate about mentorship. Um, and we know that we know how important it is. And seeing, I've had actually several summer scholar students come back in the last one of my older summer scholar students just texted me that she's applying for pediatric fellowship residency. She's finishing medical school now, and I got her from Western High School. Um, what is it, 9 or 10 years ago? And I remember I told her, I said, "Don't blink, it's going to go so fast." And she kept in touch with me. Not all of the summer scholars keep in touch, but I love when people keep in touch. And if you find somebody in any of these types of programs that reach out to young people, they obviously have a passion for it and have a heart for it. And if you keep in touch, I mean, you'll never know where things could take you. I mean, my mentors from when I was the first summer scholar at the Cleveland Clinic are now my partners in practice for 25 years. So you never know where you're going to find a mentor. Now, if I had said, "Oh, colorectal surgery, that's gross, I don't want to do that," you know, I wouldn't have received the mentorship. So I think always keeping an open mind, and you never know who you're going to meet and what you're going to learn from them. Every single person that you meet every single day, I'm sure you can learn something from if you look for it. So I think keeping a positive attitude and looking to every interaction that you have, and sometimes mentors will sneak up on you and you never expected them. So always keep your mind open.
Yeah, definitely. The Summer Scholars Program was like my first introduction to that people in even industries like medicine who I thought were really busy and would be really like not open to students because I didn't imagine that. We're so open and they taught us so much, especially when we got to like meet patients and they would kind of like showcase what they do step by step and like show us what the diagrams mean, what they're doing. Like even when we were watching your surgery, you were kind of narrating the surgery and it was so cool because you told us to keep a notebook during that experience. And I still like look back to the notebook when I'm like doing my HOSA events and I'm like, oh, I learned that and I can connect it. So it's definitely like meeting your mentors and seeing that they can teach you a lot. And also, I remember in one of after you showed us one of the surgeries, we asked you how you balanced basically the demands of being a colorectal surgeon and also being a mother and a wife and also a woman. So this question is, how do you balance the demands of being a colorectal surgeon with your personal life?
So I'm not sure which answer I gave you, and that answer can change depending on the week. But one of the things that I think is really important to realize, like I see so many young women come through, especially in summer scholars, and I hate to break it to you guys, but there is research out there to show that women make better technical surgeons than men. I don't want to get in trouble for saying that, but it's totally true. There is genuine validated research studies that show that we have better outcomes. So when I see you guys come through who are just the best and the brightest and the most caring, and then you get told by people and by society, no, don't do that. It's too hard. It's too hard. You can't, you're never going to be able to have a family. Don't you want kids? Don't you want to do that? And that's what I try to show people is that you can have everything. Now, you may not have, and I think I told you this, you may not be able to have every single thing at the same exact time, but you can balance things and you can do certain things in your career when your kids are young and you're raising them. And, my kids went through Cypress Bay High School, just like you. I don't know if all of you are at Cypress, but I mean, my kids went to Cypress Bay. I know all the teachers at Cypress Bay. I did the homework with them. I was the chemistry tutor and the biology tutor. I remember the Krebs cycle because I just did this with my kids, not too many, just in the last few years. So I balanced everything. I made choices. I wanted to be home to see my kids grow up, and I wanted to be home to do homework, and I wanted to be home to be involved and see what was going on. Well, maybe that meant that I did a little bit less international travel to promote my surgical career. Maybe that meant that I made a little bit less money. So I made a choice when my 20-year-old son was 1, when he was turning 1, I said, you know what, if I'm not careful, I'm going to miss this. He's going to be 10 because we didn't have any trouble. There were no problems. I had a wonderful woman who lived with us, who's actually here with me now visiting, which I'm so happy about. And everything was facilitated. The kids were fine, but I realized I didn't want to miss everything. So I made a choice. I worked 4 days a week instead of 5. I worked 80% time and I made 80% pay, and that was fine. And I remember when both kids got into full-time school, and I said to my husband, I said, do you think I should go back to work on Wednesdays? And he said, what are you, crazy? You have Wednesdays off. And that's when I started going to the gym and I started working out and I started, doing all sorts of other stuff so that I could maintain my own sense of self. So how do I balance it? You can have everything. You just can't have everything at 110% all the time at the same time. And there's a time and a place for everything. So when and that answer is different for everyone. And you have to remember what the answer that was right for me may not be the right answer for other women. It may not be the right answer for you. So what you really have to do is be very, very careful and know yourself and know what you really want. Because if you really want to become that powerhouse, internationally renowned, on the lecture circuit surgeon, and you didn't want to be doing Mommy and Me and the Krebs cycle, then know that and be the international surgeon and make different choices in your home and be okay with that. But if you wanted to be home doing the Krebs cycle and making sure that they were prepared for the biology test, don't be in France giving a lecture. So you have to know what's really important to you. And then also, I always said, I wanted to, when I was working and the kids were young, I still worked really hard, but I stayed relevant enough in the international and national colorectal surgical research world and cutting edge surgery that people knew who I was, but I wasn't the one out there giving 50 lectures. I would go on one international lecture and 1 or 2 national meetings per year. That was it. And I set a limit for myself. But now my kids are gone. We just became empty nesters this, 2-3 months ago. And I can do whatever I want now. So if I want to ramp up my lecture circuit, I can, and it's fine. And I still have things that I can talk about because I've been working hard all this time. But interestingly, what I really want to ramp up are my high school programs and mentorship programs, because that's what's really interesting and most fulfilling for me. So you can balance everything, but you have to know who you are, know what you really want, be honest with yourself, and then recognize that you don't really get to have everything all the time at the same time, and you have to be patient. So,
Yeah, I love that idea of making certain sacrifices and not having everything at the same time. Because most of the time they tell you to sacrifice your career in general, but you don't have to do that. You could just do one part at a time to get the whole. So that was really inspiring.
there's a lot of different ways to do this, and again, I think knowing yourself is the most important. And if you really want, I have friends. One of my dear friends is, she has kids that are a couple years younger than me, but she is already did it, but a meteoric rise to surgical stardom, and she was president of the National Societies. That's what she wanted. And her husband stayed at home more and had more of a research position and could do that. And he had a little bit more of the attention for the kids when she was doing more of her traveling. But that's a choice that they made together in their marriage and their family with their kids. And she's going to be president of every surgical society. And I love her. And she's happy and she knows what she wants. It's when you don't figure out what you really want, or when you let society decide what's important for you, not what's really important for you.
Yeah,
So,
definitely.
Yeah, I feel like my mom gives the same advice to me, but except apart from medicine, she's in software engineering. So, she's always told me to do the hard things, don't do the easy things.
mm,
And she inspired me to take AP Physics 1, AP Stats. Even though I didn't get the best grades, I learned a lot from them. And I'm still grateful for her because she inspired me to take those classes. So, have you seen any significant changes in surgery, spec gender specifically? Like, have you seen more women come in?
oh yeah. So when I became a colorectal surgeon, I don't have the new numbers now, but there were 12, I hope I say it right. There were 1,200 women colorectal surgeons. Yeah. So 50, ma'am, I must be saying it wrong. There's a whole lot more women now. I want to say there were 1,200 women in the whole United States that were colorectal surgeons. I think that's right, but it seems a little high even for them. But the now coming through, we have whole classes of residents that are women, and I don't have the exact numbers, but when I was at Jackson Memorial and we had 30 categorical residents in surgery, there was me and one intern, so 2 out of 30. Um, and and I remember one of the women that was a little older than me, a year or two ahead of me, I said she had actually came in late and had a kid, and that was unheard of. I think she was older and had a career before, and she had kids before she came. And I said to her, I'll never forget, I said, how is it being a surgeon and being a mom? And she said, whenever you're doing a good job at one, you're doing a bad job at the other. And I just don't think that that's true. Now there's so many women. We have research years. The women, there's built-in maternity leave. I mean, when I trained maternity, I mean, you didn't get pregnant. I mean, I didn't even get pregnant until a year after I went into practice, because I didn't want people at my job to look at me and say, oh, you just got here and got pregnant. Now people show up for fellowship pregnant, they have a kid, they do their maternity leave, they come back. I mean, nobody even cares anymore. And like I said, there's so many more women. We have, a huge percentage of women coming through for our colorectal surgery fellowship. So I think it's very, very different. There are still some specialties that are less, I think, like orthopedic surgery, probably neurosurgery, fewer women, but what do you care? If you love it, do it, you know? I mean, more than half of the medical school students are women now. So that's what we're going to do. We're going to go be the surgeons and do it, and we're going to do a great job of it, as has been shown in, I think it was in Lancet or New England Journal. There was a recent article that said women surgeons have better results. So
I loved when you said, like, when you love it, do it, because, like, why should you place the limit on yourself, right? Like, be responsible for your own success and, like, go for it, kind of, and that's something that we've heard from a lot of the other women that we've mentored, like, don't place the limit on yourself,
Hmm.
uh, go for it anyway. So, in your career, is there any defining moment that you, like, vividly remember that maybe changed your perspective on something or just changed something for you in your career?
Wait, that's a really good question. Every day is not every single day is defining, but you know, getting to teach and seeing the summer scholar students come back as surgeons. I mean, I was in the South Florida chapter women surgeons meeting this year, and one of the women surgeons came up to me and she said, "Dr. Sands, I just want you to know I was your summer scholar," and now she's a practicing surgeon. So getting to see the impact that you can have. I think there's two places professionally, there's two places that I get to have impact, and that's with patients and what we can do for them, and it's with the students that learn from us. And for me, I especially love it because when I get this you summer scholar students, you're pretty young, and like I always tell you guys, there's like way easier ways to live your life than becoming a surgeon. You can get TikTok famous. You can, I don't know, they sell all kinds of stuff on the internet. I don't even understand all these things. But, you know, being a surgeon and making life-saving decisions every day and cutting through people's bodies and trying to do it right and trying to learn how to do it is really, really hard. And being able to have an impact with my patients and with you guys is really what I can't think of one single defining moment, but that's what defines me every day. And that's why I get out of bed every day to be able to do what I can do for the patients. I feel like if God gives you a gift, you have to use it. And then to see you guys, move forward because one day you're going to be my doctor and take care of me. So, but seeing you guys move forward in a world where there's just nothing adds up to tell you guys that you should do this. The odds of getting in, the odds of staying in, the amount of work, the low pay that you're going to get for a really long time until you can actually get a real job. I mean, all of these things, your ovaries and how long it takes before you delay a lot of things that your counterparts and peers are going to get to do earlier than you, and they're going to, your friends are going to go to college and go get a job, and I mean, I used to say I'm going to make more. I've made more money as a waitress than I have as a doctor for a long time until, I mean, not now anymore, but for a long, long time when I, went through medical school, went through surgical training. All these things are a bunch of perceived delayed gratification. But what it really is the impact that we can have on other people. And whether it's cutting out their cancers and curing them and letting them go back to their family or inspiring you guys to take that harder path, that's really just what defines me every day. So it's really a gift.
I like the idea of delayed gratification because I've heard other people say that in different industries, but I feel like it's really pertinent in medicine just because, like, the overall of what you can do, how you can impact patients, how you can connect with them, especially when I was watching doctors like deal with patients in front of me, it's really like it's very satisfying and very honest. So I wanted to ask, you talked about the advancements of more women in the medical industry and colorectal surgery. So what advancements in colorectal surgery are you most excited about and the future of the field in general?
So anything that we do in surgery, um, we try to have a cure rate with the least impact on the patient. So to be able to cure a patient's cancer with the least long-term implications for that cure. It used to be years ago that if you had a cancer in your rectum that was, more than, there you go, 5 centimeters, less than 5 centimeters from the lowest part, everyone would get a permanent colostomy forever. And one of the things that actually today was, I wasn't supposed to be working today, but but I got to go into the hospital to work with one of my partners to do what's called a TATME, which is a transanal total mesorectal excision, where we took out the patient's entire rectal cancer with their rectum and was able to restore them and suture their intestines back together from a level of 1 centimeter away, and help that person to not live with a permanent colostomy, and then also be able to do that minimally invasive with almost no incisions on the belly at all. So to be able to cure cancers with less long-term impact to the patient in minimally invasive ways and in more precise ways is what's exciting to me in the field of colorectal surgery.
That's amazing. So many young girls want to do what you're doing, especially in uEmpower. They want to change lives, they want to save lives, and they want to make impact to patients. So do you have anything else to say to our uEmpower members? Any pieces of advice, inspiring words, anything like that?
Well, I would just say, first of all, I love what you guys are doing. I think that reaching out and joining together and showing that there's power in numbers, and showing the people that around you that you can do anything. And the other thing that I would say is, my question to all of you is, what in your life that was ever handed to you without any struggle, just handed to you, did you cherish and value more than anything? So if somebody just hands you something easily, what do you care? It was easy. It's the stuff that you work really, really, really hard for, that you cherish and that you value. And those are the defining things. And this career, this path for me, I wouldn't change a thing. I graduated medical school in 1996. I graduated high school in 1988. I still get up every day and I go to work and I'm excited and I'm happy and I'm proud of what I do. And just remember that it's the harder path that you have to struggle for, that you have to work for, that is the one that you're going to value in the end. So
That's amazing. I never thought about the value idea that because anything that I value definitely is what I've worked very hard for and things I've been definitely very frustrated over. And I think Aadya and Ayushi can agree on that aspect.
Yeah. I think that every time, like even if it's something small like a test, the test that I've put more tears in for and more like all-nighters for, those are like the results, even when they're not that good, those are the ones that I enjoy the most because I know that I learned the most out of that experience. So
those are the defining ones. I mean, you said the AP stats and the AP physics. They're not easy, but you have to be, I mean, you work for that. You work for that stuff, and it builds your character and it makes you hungry to fight harder and do more. And I mean, if you took AP physics and they told you, you know what, we're just gonna give you an A. Don't worry about it. Don't worry about anything. We're just gonna give you an A. Would you feel that you did something great from that? No, you would, I mean, that you would be gypped, you know? So, I mean, just remember the things that you work hard for are the things that you're going to remember and the things that you're going to cherish and the things that you're going to value. And when you have that value in yourself, you don't need to look for it from anyone else. You don't need to be validated by the people around you. That comes from within yourself. And that's what's really important. And you should focus on that, focus on what's important, work hard, and remember that, it's been proven that we make better surgeons. So come and be surgeons with me because it's really fun.
I think that's what we try to tell our like members and like the different girls that we have worked with. Like it's always internal validation and internal acceptance and satisfaction over what anyone else tells you because it's like your path, it's your life. So why should someone else be the dictator of it? So
100%.
Okay, that concludes all of my questions. Thank you so much for taking part in our Connect event with Dr. Sands, and thank you for sharing your advice on your experience being a colorectal surgeon.
Thank you so much for the opportunity. I really enjoyed it.